Welcome back to Healthy Life. We're talking about how parents, a couple, might influence the sex of their unborn child at the time of conception. And with us to talk about it is Dr. Tarun Jain, who is a fertility specialist at the University of Illinois at Chicago. So Dr. Jain, what about other factors besides the diet of the mother that might have an impact on sex selection at the time of conception or the implantation of the embryo?
Yes, good question. There has been a method that was developed in the 70s called the Shuttles Method, which is based on the theory that Y-bearing sperm swim faster than X-bearing sperm. Now I have to highlight the fact that this is simply a theory. So the Shuttles Method claimed that if women were to have intercourse closer to the time of ovulation, the faster Y-bearing sperm would lead to them more likely having a boy, as opposed to a girl if they had intercourse further away from the time of ovulation. Now this is simply a theory, and in fact there was a very good study in the New England Journal of Medicine a few years ago which essentially found that the timing of intercourse had no relationship to the sex of the child. So really the science has not borne out with some of these other theories that have been put forth out there in the past many years.
Are there any other factors that might affect sex selections, like smoking or drinking alcohol or caffeine, all the things we talk about in terms of pregnancy health in general?
No, there's no scientific evidence linking any of those other factors that you mentioned, any behavioral or environmental factors that we know of, linking the chance of having a boy or a girl. Essentially, it's primarily a 50-50 chance. There is an equal number of X-bearing sperm and Y-bearing sperm. And as far as science is concerned, the evidence simply does not support any of those other factors leading to a higher chance of a boy or a girl.
Is it true that the rate of producing males is slightly less now in industrialized countries, that it's been dropping a little bit? And if so, what might account for that?
Yeah, some of the epidemiologic information does suggest that there seems to be a slight decrease in some industrialized countries in the boy-to-girl ratio. What is accounting for that is very unclear. There's really no good evidence to support what the reason for that is. There could be many reasons behind it that science has not been able to figure out as yet. Certainly there could also be parental factors. Certainly we know that in many countries abortion is acceptable and for that very purpose, and so that could also be a potential confounder that could account for some of these changes that we're experiencing. Now, with regard to the diet issue, certainly in the United States we know that there's an obesity epidemic, so if anything we should be seeing a reverse if that other previous study was true, that with a higher caloric intake it had found more boys, but in the obesity epidemic we should see a higher boy-to-girl ratio, and we're not seeing that.
What about so-called gender selection clinics where there is actual manipulation of sperm? What is done, and is this ethically acceptable?
Yeah, it's a great question. There's currently two methods that are available. One is Sporran Sorting. Essentially, the X-bearing sperm weighs a little bit more than the Y-bearing sperm. So a technique has been developed by a company to sort out the sperm based on their differential weight. That company has been performing an FDA-sponsored clinical trial for many years now to determine if that technique is safe and effective, and that trial should be ending soon, and so that technique will probably be commercially available in not so distant future, where couples can then undergo artificial insemination to have a better chance of a boy or a girl. And the other technique is undergoing in vitro fertilization along with use of PGD, or prenatal genetic diagnosis, where through a test the lab can determine if an embryo is going to be a boy or a girl. Now these two techniques are available and many clinics are already offering them. As far as the ethics are concerned, that is of great concern to many ethicists as well as our own medical societies. Our own American College of OBGYN currently does not favor using such technology simply for family balancing, or what they call social sex selection. These techniques were really developed to treat medical conditions, couples who have medical conditions where if they were more likely to have a boy, they would get that genetic condition like hemophilia or muscular dystrophy. So for those purposes, it's clearly acceptable, but for family balancing, it's still questionable from an ethics standpoint, but it is commercially available.
And, you know, as we even talk about it, and as you so succinctly describe these techniques, it really does sound like interfering with Mother Nature in a very direct and open way, doesn't it?
Yeah, and that is the concern with the ethicists. One of the main concerns is that it could unduly influence or change the sex ratio. It could place a greater importance of a boy versus a girl in society, leading to a gender imbalance. And certainly there's legitimate concern for that, seeing what's happened in other third world countries. So interestingly, actually, some of my studies, I looked at patients in Chicago and in Boston to see how interested they would be in using such technology, and a fair number were, but interestingly, there was about an equal preference for boys and girls. So the preferences may differ based on culture and society. Yeah. But having said that, I think it's still, it is playing with Mother Nature a little bit, as you mentioned.
Dr. Jain, we thank you so much for taking the time to join us. Very interesting information. We'll have you back someday. And we thank all of you for watching us on this edition of Healthy Life. If you want more health information, go to abcnews.com and click on the health page. I'm Dr. Timothy Johnson.